Now, this is a story about your husband.
Yes.
Okay, my first question, there he is, look, is did your husband take the COVID-19 shot?
No, he did not. We were both very hardcore anti-vax, from the very beginnings of our marriage.
And how was his health? Because to talk us through the timeline of what happened, because this is a story that's a little bit different, everyone.
He was healthy. He was active. He was a healthy weight. The spring of 2021, he came down with COVID, and I megadosed him on D3 just like I did when I had COVID and had it beat in just a few days. But his COVID was hanging on. His primary doctor kept saying it's unresolved pneumonia and related to COVID, because he was diagnosed with COVID and double pneumonia. And the doctors kept telling him it's, long haul COVID, long haul pneumonia, just go home and rest as your body wants you to. And at Thanksgiving that year, he usually packs away 2 or 3 plates of food. He ate a little bit of a bun with some turkey, and he walked away from the table. It's like, okay, this is not my husband. This is not normal. And so his primary said, I'm not going to do any further tests on you until you have health insurance. And we didn't have health insurance when this all began. And I said, well, we've got it. We're just waiting on the cards. He goes, regardless, I'm not doing anything more. And so on the morning of January 23rd of 2022, he woke up, he couldn't breathe. And so I took him 20 miles to the east of us to a different medical center. And the doctor came in and said, I don't have any good news for you. You have metastatic cancer. And we felt like we had been sucker punched. Sorry.
Laurie, you're fine. Just take your time.
And so after the doctor left the room, I said, I asked him, I said, what are we going to do? And his first words out of his mouth was, I'm not taking chemo. I said, okay. He said, we're heading to North Carolina to Dr. Batar's office there in Mooresville. I said, okay. And so 2 weeks later, we were on our way out there. And he started the process just a few days after we got out there. Usually there's a 6-month waiting period to get into his practice. But since he was in such a late stage, when they found the cancer, his prostate and his liver, both lungs, his pelvis, his starting to affect his left hip, and halfway up his spine. And so they got him started in treatment. And one of the treatments was they would do ozone treatments, and that's where they take blood out of the body, treat it with ozone, then put it back in. And his blood was totally normal during this whole time. And on week 3 of treatment, every Monday they would do tests on everybody, and they said his hemoglobin had dropped too low for him to continue without getting blood. I said, well, this is perfect. We have the same blood type. We have the same back deformity. We even have the same antibiotic allergy. So, I'm the perfect donor for him. And they talked to the hospital that they worked with where he was going to have to go get the blood from. And they said, because of COVID, their resources are best used for community blood rather than directed blood. And I said, no, there's no way. We don't want him to get vax blood because of all the complications that are arising from people that are getting the jab. And they refused to budge, and he made the decision to go ahead and take the community blood. And that morning, I dropped him off at the hospital. I said, I'm sorry, I can't stay here and watch you do this. So I left and went back to the motel room for a while. And this was on a Wednesday. Friday, they took out the blood to do the ozone treatment again. And I noticed after all the blood had gone back into his body that there was these white strands in the blood bag. And I asked the nurse, I said, what are these? And she said, we don't know what those are, but we're not going to worry about them at the moment. And I wish I would have the thought process to take pictures of the blood bag at the moment, but I was physically tired and I couldn't really think straight some of the time. And he started sleepwalking after he got the blood. 10 days after he got the blood, it was a Saturday morning, he woke up and he was having a hard time breathing. He goes, Lori, take me to the hospital. There's something wrong. And so I rushed him to a hospital. It was just a little over a mile away from us at our hotel there in Huntersville. And they did a CT, they rushed him into a CT scan. And the doctor came back in and he said that the cancer had exploded throughout his whole torso. It spread to his adrenal glands. The lymph nodes in his lungs had swollen up so badly that it was blocking off blood supply to his lungs, and he had also developed a blood clot in the upper lobe of his left lung. And he said, "I'm sorry, your fight is over." And he left the room. He closed the door, and my husband and I just started crying so hard. They probably heard us all the way out to the nurse's station. And so we got home 5 days later. He entered hospice. And in 27 days after he got the blood, he was gone.
Oh, Laurie, this is just such an awful story. I'm so sorry. Got these pictures of you both. Laurie, this is sadly, tragically, not the first story we've heard of contaminated blood.
This is a day of shame for the British state. Today's report shows a decades-long moral failure at the heart of our national life. From the National Health Service to the civil service, to ministers in successive governments, at every level, the people and institutions in which we place our trust failed in the most harrowing and devastating way. They failed the victims and their families, and they failed this country. And the result of this inquiry should shake our nation to its core. This should have been avoided. It was known these treatments were contaminated. Warnings were ignored repeatedly. Time and again, people in positions of power and trust had the chance to stop the transmission of those infections. Time and again, they failed to do so.
There is a website called Safe Blood. I believe it's .us that they're asking for donors who haven't gotten the jab to donate to, and I've signed up for that. And you can survive without, you can survive a great blood loss without getting blood. 2 weeks after our son was born, I lost 65% of my blood supply, and I refused all blood transfusions. And it took me a year to get back on my feet, but I'm still here.